Hello and welcome to the Calgary Adult Bariatric Surgery Clinic. I'm Liz, one of the clinic's nurses. This orientation will review different types of bariatric surgery offered at the clinic, surgery advantages and disadvantages, bariatric surgery outcomes and possible complications, and the commitment to healthy lifestyle practices needed to support positive bariatric surgery outcomes. For this session, please have your guidebook and a pen to highlight important points and record questions that you have. These questions will be answered during the orientation class led by a registered nurse. Obesity is considered a chronic disease, which means that the disease is recurring over a long period of time. Illnesses associated with obesity can include obstructive sleep apnea, diabetes, high cholesterol, or high blood pressure. Obesity may develop due to a number of factors such as environment, genes, mental health, medical issues, injuries, or medications. All this explains why the eat less and move more message or dieting advice is so unhelpful. Lifelong weight management requires much more than this. There are a variety of ways to treat obesity. Some patients find that working with a registered dietitian or registered mental health professional to develop a personalized lifestyle and weight management plan is helpful. Others may speak with their family doctor or medical specialist about the use of medication to aid in weight loss. Bariatric surgery is an option for weight and obesity management when other options have not been effective. These surgeries can significantly reduce your weight, help improve or resolve many obesity-related diseases, and improve your overall quality of life. Bariatric surgeries are performed laparoscopically, which means that small incisions or cuts are made on the abdomen and the surgeon uses long instruments and a camera to complete the operation. The Calgary Adult Bariatric Surgery Clinic offers two bariatric surgeries, the vertical sleeve gastrectomy and the Roux-en-Y gastric bypass. During a vertical sleeve gastrectomy, a large portion of the stomach is permanently removed. This surgery reduces the stomach to a pouch the size of a small banana. There are no changes to the intestine, only to the stomach, so the body will continue to absorb most of the calories and nutrients from food and fluids. Advantages to the sleeve are that it helps to restrict the amount of food you can eat at one time. It causes a change in gut hormones, which suppresses hunger, makes you feel full longer, and reduces the way obesity triggers diabetes. The disadvantages of sleeve surgery are that it cannot be reversed, and there is an increased risk for heartburn, reflux, and nutrient deficiencies. During a laparoscopic Roux-en-Y gastric bypass, the stomach is reduced to a small pouch the size of an egg. The remaining larger portion of the stomach is not removed. The pouch is then attached to the middle portion of the small intestine, known as the jejunum. When you eat after surgery, your food will enter into the pouch and then into the jejunum, bypassing the large portion of your stomach and the first portion of the small intestine, the duodenum. The remaining stomach and the duodenum attach to the jejunum as pictured on this slide to provide digestive and gastric juices from the stomach. It may be helpful to access online resources listed in your guidebook to help you fully understand the details of the gastric bypass. Bypass surgery can be helpful because it restricts the amount of food you can eat at one time. It causes a change in gut hormones, which suppresses hunger, makes you feel full longer, and reduces the way obesity triggers diabetes. However, bypass surgery is the most technically challenging, which can result in greater complication rates. There is a risk for nutrient deficiencies because food now bypasses the duodenum, the first portion of the small intestine. Due to the complexity of this procedure, this surgery should be considered permanent. Surgical complications are not common, but bariatric surgery is not without risk. Review your guidebook for a list of these possible complications. As with any surgery, there is a risk of infection, blood clots, cardiac or heart complications, reaction to the anesthetic, and a rare but real risk of death. Immediate postoperative complications may include bleeding, leaks from the internal suture lines, and infection. You will be monitored at the hospital for signs and symptoms of these complications and treated as needed. Long-term postoperative complications may include gallstones, nutritional deficiencies, ulcers in the stomach or small intestine, and strictures, narrowing of the digestive tract. Any of these complications can result in decreased food intake, which may necessitate tube feeds. Average weight loss following surgery is typically 20 to 30% of your starting weight. It is normal to gain back a small percentage of this weight over time. We encourage you to calculate what 20 to 30% weight loss may look like using your current weight. This may help to create realistic weight loss expectations following bariatric surgery. Some people are content with this and enjoy the health benefits that come with weight loss. Unfortunately, some people are not satisfied with their weight loss and expect to reach and sustain unrealistic weight loss goals. Managing expectations about bariatric surgery is an important part of surgery success, and we encourage you to accept your best weight. Best weight is the lowest weight you can achieve while at the same time maintaining the healthiest lifestyle you can enjoy. Establishing and maintaining a healthy lifestyle for life is the key to long-term surgery success. Healthy eating habits, engaging in regular physical activity, and maintaining good mental health are important in sustaining a healthy lifestyle. The bariatric team will help and encourage you to do this throughout your time in the clinic. It is important to understand the bariatric clinic process. As you follow along in the orientation guidebook, you will see that you are in the first phase, getting started. Once you have attended the orientation and your intake package is sent to the clerks, you will be scheduled for an assessment with a registered nurse. While you are waiting, review the videos and modules on the Calgary Adult Bariatric Surgery Clinic website. It can be helpful to re-watch the Bariatric Surgery Essentials video and create 1 or 2 goals to work towards. During the assessment phase, you will meet with a registered nurse, dietitian, psychologist, and an internal medicine physician. If applicable, you may also meet with a social worker, a nurse practitioner specializing in diabetes management, or a physician specializing in bariatrics. Your team members will help you set goals to work towards. Each member will be assessing a different part of your health to ensure that you are safe for surgery. During this phase, you will also attend a nutrition class to learn about eating habits recommended for patients who undergo surgery. Appointments occur over many months. Follow-up appointments are often required with each team member and are scheduled over months to years. Once your team feels that you are safe for bariatric surgery, you will be assessed by a surgeon. During the preparation phase, you will continue to attend scheduled appointments with the clinic team members every 2 to 3 months while you wait for your surgery date. It can take weeks to months to receive a surgery date. It is important to maintain the lifestyle changes you worked on during the getting started and assessment phases. You will be scheduled to attend a surgery prep class and a pre-operative nutrition assessment as well. When the surgeon's office gives you a surgery date, their clerk will tell you how long you will need to be on a liquid diet. You will be supported on this 2 to 12-week pre-surgery liquid diet by your dietitian. Surgery will occur at Peter Lougheed Center or South Health Campus. You will be provided more detail when you receive your surgery date. You will stay in the hospital for 1 to 3 days and at home from work or school for 4 to 6 weeks. Your bariatric team will support you following surgery. Every 3 months for the first year, you will have an appointment to ensure that you are progressing safely. Optional post-surgery classes will be offered to further support your recovery and the adjustment post-operatively. If all is well after 1 year, you will be discharged. We will contact you annually for 5 years to monitor your health and safety and collect data to help with program development and ongoing funding. Review your guidebook for further information on this follow-up schedule. The Calgary Adult Bariatric Surgery Clinic program is based on self-management principles. This means that you are expected to participate in your care and lifestyle changes. The Bariatric Clinic team is here to provide education and guidance as you set new goals towards healthy lifestyle changes. You are responsible for your own health. You are expected to prepare for every appointment, whether it is in person, on the phone, or virtual. This means attending every appointment with your guidebook, a completed food record, a list of your medications and vitamins or supplements, and any questions that you would like to discuss. You will be asked about your progress on the goals that were set during previous appointments. It is important that you come ready to discuss these. Review the appointment details in your guidebook to help you plan and stay organized. Due to the risks associated with surgery, this may not be the right or safe choice for everyone. There is no guarantee you will be approved for bariatric surgery. If you do not meet your goals over 2 to 3 successive appointments, or if you cannot make the changes necessary for bariatric surgery, you will be discharged. Assessing safety for surgery and your understanding of how the surgery will affect your life is our main concern. Assessment is ongoing, and the decision about whether surgery is safe or right for you can change at any time. Missed appointments and classes impact wait times for other patients. Please call our clinic to reschedule if you cannot attend due to illness or emergencies. If you miss 2 appointments or classes, either in person, by phone, or online, you will be discharged from the program. An appointment or class canceled with less than 48 hours notice will be considered a missed appointment. If you are late or unprepared for your appointment, you may be required to reschedule. You are required to attend appointments every 2 to 3 months once you have completed your initial assessment with a registered nurse. It is your responsibility to schedule these appointments. If you had not had contact with the clinic for 6 months, you will be discharged. The next step is to attend an online orientation class with a registered nurse. This should be scheduled for you already by the clinic clerks. Call our main phone number if you have any questions. Bariatric surgery is a major life-changing surgery. It is important that you take the time to educate yourself on the different types of bariatric surgery and the lifestyle changes required to help make surgery successful. Take time to reflect on whether you feel like this is the right time in your life to pursue bariatric surgery. If you decide at any point that bariatric surgery is not right for you, notify the clinic. Following your orientation class, if you decide that you are interested in bariatric surgery, complete your intake package and return it to the email address provided. Once received, a clinic clerk will call you to book your initial assessment with a registered nurse. While you are waiting for your appointment, review your guidebook and the clinic's online resources. Based on the bariatric surgery essentials listed in your guidebook, create 1 or 2 lifestyle goals and begin working towards them. The nurse will review these at your initial appointment.